and welcome to our show. We're going to be talking about the leg today. I know the New York Marathon is coming up, and been talking about running and running injuries a lot in my practice as well. And I think most of you who run have either sustained an ankle injury or a foot injury or a knee injury, or have experienced pain or stiffness somewhere in the leg when running. And even if you're not aware of any pain, I think it's really powerful to develop a new understanding of how your leg works, so that the image that you have of your body in motion as you run is more integrated along the myofascial chains that actually propel movement, the part of the body that medicine forgot. So the Seeker's method is a way of connecting with fascia using movement and touch, breath and awareness to find and release the restrictions that you have in your tissues as a result of your unique injury history, your exercise history, and how you're built. So we're all different, and even though there are syndromes that we have in common, the places where we get stuck are unique to us. And knowing where your body has stuck points allows you to take a more targeted approach to your training, your self-care, your therapy, and knowing how to adjust and compensate for those unique restrictions that you have will help you release them over time, improving your wellness, your performance, and your quality of life. So when I was an ER physician, we used the Ottawa ankle rules almost every day to decide whether someone who came in with an ankle sprain needed an X-ray or not, because they might have had a fracture. And most of the people we saw who did not have a fracture, who just had an ankle sprain, were typically told to go home and follow the Rice method: rest, ice, compression, and elevation, for the first few days. And then, the standard instructions were maybe some physiotherapy if it was a more significant ankle sprain, but what physiotherapy meant, we weren't sure. How many sessions, for how long, what are the goals of treatment, what's the best way to do it. Never really taught that in medical school. The evidence is quite clear that therapy can help, but exactly what therapy is best is not 100% clear. But I'm suggesting that no matter how long it's been since you sprained your ankle, you can take a mindful approach to releasing not only the ankle, but all of the other points along the chain that absorbed the shock of that injury, along the line of force that travels when you sprain your ankle all the way up the leg into the torso, and ultimately has to go somewhere. Just like a bullet has to have an entry wound and an exit wound, every impact creates a long fracture line throughout the body that typically crosses the midline, typically involves the spine at some level, and can transmit force from the left leg to the right shoulder or to the left shoulder, depending on the angle you're at when you fall. And so learning to feel where that line is can help you release that line with targeted stretching and self-care, allowing you to run more freely, not just in the ankle, but to, as we'll talk about in later episodes, how to run from the ribs and propel yourself forward with your chest in the sky. So you can start with your leg crossed, the one that you think might be sprained, or the one that has been unstable because of a bad sprain or recurrent sprains, or the one that's just stiff but you're not sure why. And you can cup the lateral aspect of the foot. You see right over here is where the metatarsal bone is. Then you have the bones of the midfoot that come up into the talus and the calcaneus, and then the fibula over here with all of these ligaments attaching the fibula to the talus. That's the anterior talofibular ligament, and coming back to attach to the heel. That's the calcaneofibular ligament. This is the side that typically gets strained. And the basic movement is always the same. You inhale and create tension. Okay? In this case, you're pushing the lateral aspect of the foot into your hand, and you're using the hand to provide just a bit of resistance. Okay? So now you've engaged these tissues. They're under tension. And if you focus your awareness on touch, okay, using very light touch, scanning the skin, and just noticing where you feel areas of altered sensation. Just a tingle or sensitivity, something feels different. Now, palpating yourself is an interesting act of mindfulness because you can shift your focus from the sensation in the fingertips to the sensation in the tissue being touched. And whether you focus on the leg or you focus on the fingertips, when you run over an area where nerves are sensitized, maybe entrapped by scar tissue, those sensitized nerves respond to light touch differently from the rest. So these areas that feel different represent sensitized nerves and points of tension. This part takes practice, but with focus, you can use light touch to slide, okay, starting with the area under tension, okay, from the tips of the toes, okay, across the lateral aspect of the foot, coming up the front of the fibula, checking the back of the fibula, and whether you feel tension here or here or here is unique to you. I like to adjust the joint while exploring for sensitive nerves, because often what you'll find is when you touch a spot and perform even one or two stretches, it will release. And you'll feel sensations moving around and tension shifting within the foot. So the way we trigger release is simply by engaging the movement with the breath. Okay? Because all of these myofascial chains ultimately attach at the diaphragm. The arm channels come in and attach through here, and the leg channels come in and attach through here. They cross that line, but the breath is involved in all movement. So when you breathe in and create tension, you can kind of feel, where is that tension? Right in there. And then maybe just adjust the angle. If I tilt my knee this way, does it feel worse or better? If I come this way, no, I think in my case it's here. And then if I adjust the foot a little bit, I think right there, that's where it feels the most tight. Okay. After exploring, I can repeat, breathe in, create tension along that angle that I just identified. Exhale and release. Okay. And then when you work with the leg, you have the convenience of having two hands. So you can do to your leg what a therapist would do to you. You can't do the same to your arm because you can only use one arm. But when you have two hands on a limb, okay, I can place this in tension and just localize that point right there. Okay. And then I can slide my hand up the leg to see where that tension travels. Okay. And I'm feeling sensation around here. Okay. So when I travel up the leg and I find the region, I can use light touch to scan around the front of the leg. I kind of feel it there. Now that may be a line that goes right through the leg, so I got to check the back of the knee. And I do feel tension there. I feel tension here, but this is more significant. Okay, so I'm comparing two areas of tension and deciding that this is the one that I want to pay attention to. And that makes sense because that fracture line travels from anterior to posterior, travels from lateral to medial. And based on what I'm feeling, I think this is related to the ACL. So I can either palpate in here or I can just put a hand here and notice how I can use my knee to engage this long line of tension, okay? Like a teeter-totter, a counterweight. That angle of torque seems to be most tight right there. Okay? So I'm pushing out on the foot, I'm pushing in on the knee, and I'm adjusting the angle to say, oh wow, that's right there. I can feel that going right down. Okay? So I want to create tension on that. I want to push my knee into the hand and resist. Okay, so breathing in. Adjusting with a wiggle in between breaths, because if you imagine these thousands of little collagen fibrils that are tangled in a web stuck together after an injury. Of course, our wounds heal, but never 100%. A wiggle after a stretch allows some movement to create separation between those fibers, promoting release. Okay? And the myofascial chains that are involved in external rotation and eversion of the ankle are also involved in dorsiflexion. Right? So they call them the stomach, the gallbladder, and the urinary bladder meridians, and they travel up the outer leg, as opposed to the liver, spleen, and kidney meridians, which are more engaged in inversion and plantar flexion and internal rotation of the ankle as they come in here through the adductors, crossing the midline at the sacrum, traveling up and weaving up the inner aspect of your frame, where these yang meridians, as opposed to the yin meridians, the yang meridians travel on the outer surface of the body. And that's why yang channels are perceived in Chinese medicine to be more associated with defense and the stress response, whereas yin channels are more related to rest and healing. This sort of sympathetic, parasympathetic aspect of the nervous system might be correlated with that, but when we think about how to move these chains, we think of outer chains and inner chains. And ankle instability almost always involves the outer chains. Okay, so in order to fully engage these chains, not only do you have to turn your ankle out, but you can dorsiflex your foot. Okay, and you can adjust the angle of dorsiflexion until you get a clear sense that the tension in that line is at its maximum. Okay? Adjusting the angle of the bones to maximize the pull on the fascial fibers that are distorted and entrapping nerves, sensitizing them, and creating stiffness and pain. Okay? Breathing in, creating tension, also with some knee flexion here, adjusting the angle of the knee, feeling that travel from front to back, connecting the ankle and the ACL through the interosseous membrane between the tibia and the fibula. Really feeling that strain in the middle of the ankle here, right at the midfoot. Okay? And based on what I know about how the body's built, I can link. You even see that little deviation in my ankle there? That's where the ankle should be. But I had it over here because this joint, it's not so much pulling on the knee, not so much the hip, not so much the base of the rib cage where the solar plexus is. Okay? More at the nipple line. Yeah, so this is the place where the sternum has a joint at the middle of it, the sternomanubrial joint. Kind of the line that separates the top of the arm from the underside of the arm, with the humerus attaching above the nipple line, and all of these tissues in here attaching beneath the nipple line. So imagine an ankle sprain that creates a torsion in the body that impacts primarily the ankle and this layer of connective tissue, right, where this long chain intersects at that sternomanubrial joint. And that's why I've had thoracic outlet syndrome for 30 years. That's how one ankle injury can change your life. And that's why learning how to connect with your fracture lines can not only help you with foot pain or knee pain or hip pain, but it can connect you with this long chain which is moving when you run, right? With one side of the thoracic cage sort of shaped like fists. As you swing your hips, those rib cages are twisting back and forth. So you're running from your sternum. And that's how you get that feeling of flying. You're barely touching the ground, like that crouching tiger, hidden dragon. From lateral flexion, we can come to medial rotation, plantar flexion, and inversion of the foot. This is where we get into plantar fasciitis. Right? So same idea, but I'm just assessing the other side of the foot now. I've got the spleen channel, which is sort of connected to this flexor hallucis longus as we bring it down. Then we have these muscles on the side, the interossei and the intrinsic muscles of the foot. You have several layers that connect the calcaneus or the heel bone to the bones of the midfoot and then the metatarsals, because when you do this, you're engaging lines of force that travel from medial to lateral and lateral to medial. So understanding that all movement involves this twisting pair of joints rotating at either end, whether it's in the foot or here, recognizing that all movement involves these spiral lines, allows you to trace tension along the pathways that it's most likely to present, right? So I feel some tension right in here at the base of my thumb and my great toe. And a lot of us have tension in these muscles that create bunions and plantar fasciitis and bunions and ingrown toenails and heel pain and foot pain in general is not only something that is common for people to experience in the foot, but they're also common problems related to low back pain. So many people with low back pain actually will feel a whole lot better if their feet are treated properly. And I enjoy having people walk out of my office without back pain after having treated their feet. So bringing the foot up and in, finding the point of tension using light touch, the part of you that feels just different. Okay? Breathing in and engaging those muscles, adjusting the angle to find the direction that creates the most tension. Exhale and release. Repeating that, breathe in and find another point of tension. Exhale and release. Okay, recognizing this very, very common issue of line of tension from the foot to the back of the ankle, where the Achilles tendon attaches, and underneath it, the attachments of the soleus muscle, which travels under the gastrocs all the way up here into the upper part of the lower leg. So you'll usually find one sort of focal point back here behind the ankle. And this creates a really interesting line of tension you can visualize traveling from the base of the foot to the back of the heel. Super valuable to learn to feel this and release it in yourself. Okay, so breathing in with a combination of internal rotation and plantar flexion until you find that sort of critical angle where you feel the point of maximal tension. Exhale and release. And then if you wish, you can travel further up the chain, because if we recall that this was sort of connected here, not so sure that particular point of tension is traveling to the same joint. I feel some tension here. I feel it's more significant at the hip. Yeah. And so what I'm doing is just checking in and focusing internally on tension in my body. This is something I've done all day, every day for years. So it's going to be difficult for you to do that at the start, to learn to focus on what you're feeling and trust what you feel and touch the spot that you say is the point of maximal tenderness. You're the boss. Only you feel what you feel. So in my case, it's right on the anterior aspect of the left ilium. the pelvic bone, where my femur, the bone that is that makes up the hip joint, attaches to the front here at the tensor fascial lata and the gluteus medius, which kind of hold the trochanter of the hip in place, with sort of a balance. Maybe I'll show you from this angle. You have this long bone here with attachments radiating out in a pennate direction, like a feather. And these anterior fibers are responsible for one part of the range of motion, and the posterior fibers are sort of like the antagonist of that. But of course, this side of the pelvis is also twisting on this side of the pelvis. So when I have a problem here, I can feel it right out here, but that actually travels right in here. So that line of force from here to here is where this crosses the midline. Okay? So I can push on my foot, and I can actually engage this line of tension across my pelvis. And I can feel the angle that I have to twist into right there to feel that line of tension traveling all the way up. So now I can push on the knee in the opposite direction. Breathe in. Feel that line of tension. Adjust to get it as tight as you can. Exhale and release. That was a significant release for me. So if you're following along, you're feeling different points. You're finding different points. You're twisting in very different directions depending on the line of force that traveled through your leg at the moment of impact. That's based on the geometry that your leg was in. Whether you fell like this or like this will impact how that line of force travels through you. That's a really simple, non-invasive, personalized approach to self-care that can also be applied to manual therapy, injections, acupuncture, laser therapy, targeting restrictions in fascia where nerves get stuck, become sensitized, and create stress, tension, and inflammation. These are lesions that we call blockages. And the notion that we all have lesions in our bodies that are treatable, low-hanging fruit for restoring the body's ability to heal itself by reducing levels of chronic stress, chronic inflammation, and tension, which persist after every tissue trauma, infection, injury, illness we've ever had, is a powerful medical paradigm and deserves the attention of the healthcare system. So I'm here on my soapbox advocating for blockage-based care as a historic advance in medicine. But for now, anyone who wants to can learn to find and release their restrictions on their own. See you next time.